Hi everybody, welcome back to House of Medics. It's your favourite Tanisha. And joined with me today are Tamara and Jemima. So you've probably seen from the flyer today that we're actually going to be speaking on physiotherapy. So I'll let you ladies introduce yourselves if you want to go first.
Yeah, so I'm Tamara. I'm a sports therapist. I've been a sports therapist now for 2 years, graduated 2 years ago. Yeah.
Nice.
And I'm Jemima. I'm a physiotherapist, and I have been a physiotherapist for just over a year, gone May, so that's July, August, September, about a year and 4 months.
Nice. Okay, awesome. So if any of you have back problems, like me, make sure you listen very, very, very well. They've done some demonstrations on me earlier and they've really helped me. So yeah, any information that you need to do with lower back, I think you guys are going to speak on that anyway, but it's going to be really good and really informative. So let's get into it. So I wanted to start with an icebreaker and just to kind of get you guys used to the camera and blah, blah, blah. So we're going to do 2 truths and a lie. So we'll start with you.
Yeah.
So no pressure. So tell us your 2 truths and a lie, and then we'll guess what we think the lie is.
Okay. So I've been playing basketball since I was 10. I have a brother who is 10 months younger than me.
10 months.
Yeah. And I have an older sister who is 2 years older than me.
What do you think the lie is, Tamara?
I think it's the brother.
I do as well, because it was too specific.
Yeah.
10 months,
Yeah.
like that's random.
Yeah.
I think it's the brother.
Final answer?
Yeah.
Fine answer.
But I'm looking in.
That's the truth.
Oh.
My parents couldn't wait, you see.
What's the lie?
I've got an older sister, I'm the oldest.
Oh, wow. Okay, cool. Do you want to go next, or do you want me to go next?
No, go on, you go next.
No, you go next.
Oh, all right. Yeah. Okay. Okay. I hate bananas. It's one of the worst fruits ever. But I really love seafood. I just think it's really good. And I support Arsenal.
I believe you support Arsenal.
Yeah.
Do you know why? Because
No one admits
they're one of the worst teams to won. I think you like bananas because you tried. Basically, my grandma gave me some chocho. So any Caribbeans that are watching, Tamara tried it. So I think you eat bananas.
Mm-hmm.
So I think that was the lie.
I agree.
The seafood is the lie.
Is it?
I don't like
Bananas,
seafood.
Don't like seafood. Well, some seafood I like, but I wouldn't go out my way to get it.
Yeah.
Bananas, I can't do the texture.
I agree.
Really?
And the smell as
And the
well.
stringiness.
Which lie?
There's the seafood.
Oh, okay. So
I
you do
really
eat
love
bananas,
seafood.
but
No,
okay.
No. I
You
said I
don't like
hate
bananas, but you
Love seafood.
don't love seafood.
Yeah, I don't
so
like
that's
seafood.
the lie.
That was the lie.
Okay, got you. Okay,
Yeah.
okay, cool. What are mine? I have 3 siblings. I like strawberries, and I play football sometimes in my spare time.
I think it's the football because where your back is set up.
Unless you're a goalkeeper.
You know, I just got. I done 2 lies and the truth.
The other one is a straw.
So you think the back and strawberries are the lies?
Yeah, I reckon so.
Yeah, they are. They are the lies. What you just said is really out of order. But it's true. Okay, cool. Okay, so physiotherapy. Tell us how you guys got into it. I think personally that it's a very unusual thing to actually study. I think we've had someone previously on the show that done sports something on a pitch. I can't remember what it was actually. And I actually need to see a physiotherapist. So tell us all about it. How did you guys get into it? Did you hear about it? Did somebody in your family study it? How did you even get into physiotherapy?
Who's starting?
Anyone.
Yeah, me? Okay. So literally from a very young age, I loved sports. Kind of, well, it's just me and my sister. So like you know, my dad didn't have a son, so I was the one that he kind of passed all of his sport knowledge to.
Was it football?
Football, cricket, you name it.
Oh, wow.
I gave it a go.
Yeah.
So I really love sport, and obviously I would always go to football matches with my dad and everything like that, and really got into swimming, netball, kind of played a bit of everything. And I just remember one day watching a football match, and I see the physio come on the pitch, and I was like, I reckon I could do that. Like, so I always had big dreams. I was in my Arsenal sport of, one day I'll work for Arsenal, you know, follow them around. And so it kind of stemmed from there, really, because I'm quite sporty, and I thought, you know, that's for me. And I'm not one to, even though I like to think I'm quite intelligent, I probably could have a job where I'm sitting at a desk all day, you know, dealing with numbers or something like that, but that's just not for me, because I'm more active. So I wanted to do something where I'm on my feet.
Something more hands-on.
Yeah, more hands-on stuff. I wanted to do something like that. So, yeah, I just thought that would probably be the best thing for me to do.
No, that's really interesting. So you saw somebody doing it, and then you thought, that looks like something I want to do. Okay, nice. And you, Jemima?
Mine's literally a bit similar. So obviously I've come from like an African household, so my parents wanted me to be like a doctor.
Right.
I absolutely hate blood. It makes me faint.
Seriously? Yeah. Have you fainted before?
Yeah.
How many times?
Too many to count. It's a bit embarrassing to the point.
Wow.
But also I've come from a sporting background as well.
Okay.
So I thought, okay, so what's like sort of in a medical field, but it's got sports related into it sort of thing. So I looked into like physiotherapy, looked into sports therapy. I also suffer with like knee pain as well. So I've been seeing a physiotherapy for quite some time. But mine wasn't very good. And I thought, this isn't really what a physiotherapist is meant to do, I don't think. So I kind of Googled it, went into it.
Okay.
So I was just like, okay, it's a bit of me. And then it got to obviously A-levels. You had to pick your A-levels and then you picked got the grades, went to uni, studied physio. And I was just like, okay, love it.
This is it, yeah.
Yeah, I think this is a bit of
That's
me.
so interesting. So you went to see a physiotherapist about your knee, and then you was like, nah, this is not right.
Yeah, you've not done a good job. I'm going to do a better job than you.
Wow. No, that's really good. That's really good. Okay, so talk to us about the journey. I know a lot of people in medicine had to study for 4 or 5 years. What was you guys' journey in terms of studying in college and sixth form? Why are you giggling?
To cut it short, it took me like 4.5 years to finish a 3-year course. So it kind of goes into it.
Yeah, it gets like that sometimes.
When I went in, I sort of was like, okay, so it's a lot of like bone work, but I didn't realise that you cover like cardiovascular and the neurology side of it as well.
Okay, so like I make people explain things because I'm not a medic. So cardio is that to do with your heart?
Yeah, like it's not like
your heart,
respiratory
and
sort of
neurology is
brain. So like so like dealing with people who've had like a stroke or had like those sort of things and like paralysed, etc. So it was quite really jam-packed in the first year, and obviously it's first year, it's like
let's just go back because I feel like I'm missing something. So after school you went into
sixth form,
okay, and that's when you said, okay, I'm gonna do physio. Okay,
yeah, that it was planned. I'm going to do physio.
Okay, was that the same for you then? After school, you went to
pretty much when I was probably about year 9. I'd already kind of made my mind up.
Oh wow, that's so good. Yeah.
So I kind of chose my GCSE options around that, and A-levels around that as well.
Okay. So sorry, I cut you off before. Could just continue to talk us through your studying process?
Yeah, it's just really, I want to say that I went to uni and I had like, I was partying, etc. That's why I failed first year sort of thing. But really and truly, mine was just, I didn't realise how hands-on it was, like more practical side. I thought, okay, it's the books, so you learn about, the anatomy and like the bones and the muscles, but then you actually then have to put it into place. So all my practicals I didn't do very well in. So I had to repeat the year and then do my practicals all over again. So I was just like, okay. But once I got the practical side done with, I was just like, this is pretty straightforward. You're treating what you see. There's no need to make it overcomplicated. And from then on, it wasn't like a smooth ride, but it was smoother than it originally started off with. And I think I needed that extra year because it kind of built up my confidence. And then when I finished and I went into my placements and, I got my job, it was just like, okay, I've had an extra year more than everybody else. I've had to redo this again. Yeah. I've got this under control.
So you felt more confident?
Yeah, definitely.
Okay.
But yeah, it was just it's way more than I thought it was going to be.
Right.
It's very jam-packed.
Okay.
Yeah.
And you, Tamara, tell us about your studying process from year 9, knowing what you wanted to do. Tell us.
From year 9, so I kind of knew what I wanted to do. So I knew that I would have to do well in science. Just pretty much I knew I had to do well in science to kind of get there. So I ended up in triple science, done what I had to do for that. A-levels, I chose biology. I'm going to put really now. But anyway, more like science. I didn't choose chemistry or physics because I thought, that's not for me. I need to know more about the body. So I chose biology. I wanted to take sports, but they didn't actually offer sports at the sixth form I was at. So I think in the end I chose like sociology and psychology or something like that. And then I originally applied for physiotherapy, and I just got declined by literally all of them because they were like, you don't have enough work experience.
Right.
And I struggled so much to find work experience because every time I went to someone to say, can I get work experience because I want to be a physiotherapist, they were like, no, we're not taking work experience people. Or, no, you don't have enough experience. And I was like, but this is the problem I'm trying to get experience, but you're not letting me get it.
Yeah.
So I was a bit disheartened when obviously I got declined by kind of 4 unis, saying it was all saying the same thing. I didn't have enough work experience.
Yeah. And then it's just like, how do you get the experience if no one's given me the experience?
So I was a bit frustrated, and I was like, what am I going to do? And then then I heard about sports therapy. And I was
So how did you hear about it?
Just like someone, at the sixth form, they've kind of got them like career advisor people. She was helping me then, like, okay, now what route can I take to become, because I was so set on being in the therapy kind of world. So she was like, we're going to try and find different areas for you to get into it. So then we come across sports therapy, and I was like, read all of like the course details, what you actually studied, and I was like, this actually sounds better than physiotherapy.
Right.
Like, it sounds more down my street.
Yeah.
And then obviously I had to wait for the clearing then, got through clearing and literally got a place straight away doing sports therapy, and absolutely loved it. And I don't think I would change it for anything because, obviously I've met people who are doing physiotherapy, and when I talk to them about what they've done and talk about different experiences, I'm just like, no, I'm so glad I
stuck to what you have a passion for. Yeah. Okay, no, that's really cool. So can you guys both explain the differences between sports therapy or sports therapist and a physiotherapist?
So I think like with a sports therapist, the degree is like solely focused pretty much on like musculoskeletal kind of problems and injuries.
Musculoskeletal, that's the skeleton.
Yeah, the muscles,
ankle sprains and things like that. Those ones that you see.
Ligament sprains, all this kind of stuff. Whereas we don't really explore into like how to deal with a stroke victim, how to deal with someone who's got COPD.
What's COPD?
Chronic obstructive pulmonary disease. So it's like to do with your lungs.
Like asthma, or like it's under like it's like an umbrella.
Bloody asthma, haven't I?
So we don't really explore into that, even though like later on after you finish it.
So that's to do with physio as well, though.
Yeah.
Asthma.
So no, like with COPD, they can get like a build up of like mucus and stuff as well. So physiotherapists will teach them like exercises to get rid of that.
Wow.
And teach them how to breathe properly and stuff like that. Whereas sports therapists, our kind of main aim is musculoskeletal problems and getting people back to where they want to be. Where like, so if say for example a footballer was to come to me with an ACL ligament sprain.
What's the ACL ligament?
A ligament in your knee.
Okay, I'm going to be doing this for the whole stream, by the way, guys. Because not only do I not know, some people that are watching won't know either. So,
so it's one of the most common kind of ligament injuries in footballers. So my aim would be to get them playing football again, whereas kind of a physiotherapist's aim might be a little bit different.
It's more
just getting them walking again. And whereas our aim is, I'm going to get you to where you want to be.
Right.
So say even if it was someone who came to me who had a ligament sprain as well, but they'd done it falling down the stairs or something like that, my aim would then be I'd have a chat with them and say, okay, what do you do every day? And they say, I walk the dog twice a day, so I'd love to be able to do that again. So my aim would be able to get them back to doing that again.
Doing the things that they like, they love,
doing the things that they want to do again.
Right.
Yeah.
Okay. And what about you?
Yeah, no,
a physiotherapist, what is the difference?
Yeah, it's literally like what Tamara was saying, literally in terms of the we're trying to get them, but we don't just focus on the musculoskeletal side, so we don't just focus on the sprains, etc. There's different areas to it. For instance, you can go into the respiratory side, which is where, you know, you're trying to get your patient to be able to walk again without having, you know, getting out of breath. So you teach them things like pacing. We also administer like walking aids. So ours is mainly trying to get our patients to an independent lifestyle, pain-free, just based on what their goals are, really. So it's not, we also do with like the strokes, as Tamara said, sort of thing, the stroke side. But yeah, there's a lot of crossover, I think. It's very, very similar. I think it's just physiotherapy is more broader, unless you go down, for instance, if I decided I want to specialise in sports and go down being a sports physio, we'd basically be doing along the same thing.
Okay, awesome. So we're going to carry on, but just anybody that has any questions, I know we're only about 15 or 20 minutes in, please send them through so I can ask the ladies. And also, please make sure that you give this video a thumbs up as well. So don't send the thumbs up, actually like the video as you're working it. Thank you, guys. So after you guys finished your studies, what was the next step? I heard you mention a placement. Did you have to apply for the placement, or were you put there after your studies? What was the process?
So for me, my placements was within my studies.
Okay.
So we had to do altogether, I think, 200 hours before we could... I think it was 200. No, it was 1,000 hours. Sorry, 200 on each placement. So I had 5 placements within, and I had to pass every one of them. I went to Coventry, so Coventry sorted out the placements. But I know with other unis, sometimes you have to find the placements yourself. But altogether, you need to have 1,000 to qualify, and then once you qualify, start applying for jobs. So when I was on my last placement, which was around January 2020, I started applying for jobs, started going to interviews, and then by March 2020, I'd found a job. I went into rotations first because I felt like I needed a bit more experience again.
What's rotation?
Rotations is like you spend time in certain areas. So remember we were saying that in terms of physio, you've got the neuro side and then you've got the respiratory side. I kind of wanted to broaden my experience as a qualified physio before I went to settle down into MSK physio, which is basically dealing with the ankle sprains, the back pains, the knee pains. So I did rotations for a year and then I went into static role, and now here I am.
Nice. Tamara?
Yeah. So when I was studying, kind of towards the end of the second year, beginning of the third year, we were told that we would have to do 230 hours to pass the degree. So, and we had to basically find it ourselves. So we had third year stress.
Yeah.
Plus,
so if you didn't find it, then what happened?
You would have to repeat. Like that would be one module that you just have to stay on till you
found something.
So you could complete all the hours. So luckily, the uni I went to London Met, they had one of the lecturers run their own clinic there, so we all could work in there kind of one day a week. So that gave you a few hours, but then some of them hours, I can't remember the exact amount. Let's just say it was 20, I think. So 20 hours of that had to be pitch side. So basically, you had to work for either a football team, a rugby team.
So did you have to apply to that as well?
So then I just went around and found a local football team, semi-professional team, who took me on, and I had got like my hours of pitch side there.
That sounds really fun.
And yes, you kind of had to do different things. You had to have like clinic hours, pitch side hours, observation hours, where I went unobserved, like a podiatrist, someone who specialises in your foot. I went and observed a osteopath, so you had to go off.
What's osteo?
So they deal with just your bones. Osteopath, But yeah, so I managed to do that, completed the 230 hours, then obviously passed the degree, graduated, and sports therapists aren't really looked at in the NHS. They don't really want us in there. So they... for reasons that I won't get into, but
I mean, by all means.
So basically, they just think that we're not at the same level as physios. Like it's seen as beneath physiotherapists. Right.
Why do you think that is?
I honestly don't know. I don't know if it's because obviously physiotherapists do a lot more on their degree, whereas we're just solely focused on musculoskeletal. But I honestly don't know. And I think because sports therapy is it's relatively new kind of umbrella of therapy, even though it's been around for years, but compared to like physiotherapists and kind of other things, it's still quite a new umbrella. So I don't know if it's just because it still is quite new, it's still quite looked down upon. I mean, now it is getting a little bit better. Like they are starting to get some sports therapists into the NHS, but it's like they don't want to call us sports therapists. They want to call us rehabilitation specialists. They don't want us to have our title there. So for me, I was like, no, because I'm quite proud of my title of a sports therapist.
Yeah, you've worked for it.
Yeah, I want to go and work and be able to use that title. So I basically just found a job working at a clinic in Canary Wharf. And then I've just seen a question come up about COVID. And so I was working at this clinic in Canary Wharf for just under a year. Then COVID hit. That clinic had to close down.
Oh, wow.
So I lost my job there, and we couldn't work. We couldn't work hands-on during like the first lockdown of COVID. So we could do things like via videos and stuff like that.
But nothing actually,
So I was teaching a lot of classes, so a lot of like stretch classes, mobility classes and stuff like that online. And then kind of the second lockdown and third lockdown, we could work, but only for like serious injury. So if someone was just out of, I don't know, ligament reconstruction surgery or something like that and needed to see someone, we could see them. And then obviously now it's all good. So now I'm working for myself a few days a week, doing my own seeing my own private clients. And the other days I've now got a new job in a clinic not far from Canary Wharf.
Nice.
So yeah.
Okay, awesome. Thank you. So we'll carry on, but I just want to get into some of these questions. So let's go to Nana A. It says, are you paid during the placement?
No. Be prepared to work like a dog for nothing.
Really?
Yeah.
Wait, hold on. Wait, so you're studying and you're working and you're not getting paid to work?
Not a penny.
No.
So how did you survive?
Basically had a little part-time job on the side of studying.
As well as your full-time...
Studying work experience and a part-time job,
So how did you guys manage that? How did you do that?
Very hard.
I still don't know, to be honest.
So when I first came into the degree, they were still paying, the NHS was still paying for the course. So because they were paying for the course, that means when we applied for student finance, we could get the minimum, which was like $2,300 a year. And then we were meant to get the rest from, for the year. So we were meant to...
The NHS are actually wicked. Like, they're very wicked. 2,000
for student finance
a year.
Because they were like, obviously your course is paid for, so then we had to apply for an NHS bursary. I think they gave me like an extra grand. So basically I was like 3k for the whole year, basically, is what I was using. £80 a month.
£30 a month?
Yeah, it's like £8 a month,
It was, I think for me, each semester I got just under £1,000. Like,
wow.
Each semester I got like from student finance.
Wow. Like, is it still like that now?
No, so I think they stopped.
Me, mine wasn't paid by the NHS, so I had to also get that loan to pay for the degree.
Jeez,
then obviously get a maintenance loan to help me along. But what was annoying is that the maintenance loan, the student finance look at what your mum and dad are earning, even though I wasn't relying upon my mum and dad. So I got like the least amount. So that was like I said, just under £1,000 per kind of semester. So that was kind of just my travel money to get me to and from uni on the tube. For the semester.
So did you guys heavily rely on your parents then? Did you have to sometimes say, okay, mum and dad need a bit of...
Overdraft, baby. Overdraft, but parents as well,
So you lived with
it was both, because there's 10 months between me and my brother. And my brother went to uni the next year and he got a bit more because his wasn't NHS, but he got a bit more maintenance loan than I did, sort of thing. So not all split between, but when it came to rent and sort of thing, it was just like, so mum, dad, brother, hi there. You know me, I'm just here, literally, and then
money.
Literally, and then.
No, that's really good though. That's good that they understood the situation.
It was a lot. I mean, some weekends I went down to London to work, and then obviously over the holidays I'd work as well. But it's just like the course was so jam packed. It's like you couldn't even have a job on the side, sort of thing.
So were there a lot of people on your courses, or was it a few?
First year, probably like a lot of courses, started off quite a lot of us. Then by third year, it was like...
People drop off, don't they?
Less than half of us left, kind of thing.
Okay.
Yeah.
Okay. So another question. Tunde asked, can you tell us, hi Tunde? She asked, can you tell us what a day at work is like? So tell us a day in the life. And it's going to be interesting hearing the difference between the sports therapy and the physiotherapy. So when you guys are ready.
Yeah, shall I go first? I don't want to, like, so for me, I don't feel like I'm going to work. I love my job, so for me, I don't feel like I'm going to work. But it's a typical day. So say if I'm at the clinic, so I'll go into the clinic.
Let's start by telling everyone what time you wake up first.
Okay. So I tend to, if I'm starting at the clinic at like 7, 8 o'clock, I have to get up at 5 o'clock in the morning. Because I'm obviously coming from Colchester back into London. So yeah, I usually get into the clinic.
Is that 5 days a week?
No, so I'm there 3 days a week.
Okay.
The other days I'm in Colchester doing my little bits.
Yeah. Okay.
Yeah, so probably get into the clinic, kind of check the diary, see who I've got in. Then so like a typical session would be like the person would come in. Obviously prior to that they would have filled out an email to say if they've taken any medication, any previous injuries or anything like that, just so I can have a little bit of knowledge beforehand about what's going on. And then when they come in, I tend to do a quick assessment. So what we call kind of like a functional movement assessment. So we'll take a look at like a toe touch, a squat, a back bend, a rotational twist, these kind of things to see different movements going on there. Then if that looks fine to me, I'll then lay them on the bed and do kind of an assisted version of that. So I'll like lift their leg up, move their hips around to see what I can feel.
I think I need that as well.
Yeah. And then then I'll look at the problem. So say if they've come in with back pain, I say, okay, now I'm going to look at your back. Then I'm going to look at the surrounding areas, because a lot of the time back pain, where you're actually feeling the pain that's not where the pain is coming from.
Yeah.
It's coming from somewhere else.
So guys, this is what she was telling me. I was doing some stretching in the kitchen. Pay close attention.
Yeah. So say for example, like for you, your lower back pain, a lot of the time you'll find is coming from tight glutes, tight hip flexors, tight hamstrings. If kind of what we call your posterior chains, everything at the back, if that's tight, that's going to then it's going to cause your lower back to work even more, pull down on your lower back. Your posture's then changing, and then it's just one cycle, really.
I love the passion when you speak about it's so cool to watch.
Yes, so that's kind of like a typical day. So then you treat them for their treatment, and if needed, I'll take them into there's a little rehab room. I'll take them into a little rehab room, teach them some stretches, teach them some strengthening. But the clinic, by the way, if you want to look it up, is called MyoSet. Really good clinic. But yeah, so then even if I'm doing private clients, so for my private clients, I tend to go to their house. So I do like home visits, and the same kind of applies. I'll do the same kind of an assessment.
Right.
Obviously, I won't have the same facilities there as I do at the clinic.
Yeah.
So sometimes I have to adapt it, because I might be working in a living room, so we might not have enough space.
Right.
But yes, pretty much.
Okay, thank you. And quick question, then we'll move on to your day in the life as well. What do you do when you have maybe like a difficult customer?
Difficult in what way? Like
I don't know. Maybe you can't figure out what's wrong, or maybe they don't feel like anything has changed. How do you deal with those? I think
for a lot of people, if they've never had any kind of therapy treatment done on them, they expect it to be a quick fix. They expect to come in and to walk out hopping and skipping and I'm fine after one session. But as you already know as well, it takes more sessions. Like you need to if it's a serious thing, you've got to come back once a week.
What happens if you stop being consistent in those things?
You're going to then go back to square one again.
Are you ever before?
If say for example, I'm telling you, you need to go home and do
XYZ,
glute stretches, hamstring stretches, this. And I'll say to people, I know it's not realistic to do it every day, but at least try and do it every other day. And you can tell, the next time they come in, I can tell whether they've done it or not.
Would it be looser when you feel it? Or
it will feel like, so obviously after a session, there'll be a lot more movement there. And I'll be like, you've got to do these stretches now to maintain that movement. If they haven't done their stretches, then I'm going to tell, because the movement's going to be back to
stiff again.
Also, trick question, ask them to perform what they've done for you. If you're doing it every day, you should know it off by heart. If you're not, okay, you've not done it.
Yeah, so kind of, I always explain to people in the beginning that this isn't a quick fix. If you're looking for a quick fix, you're at the wrong place. You're not going to get a quick fix. You've got to work on it yourself. You know, you've got to...
I feel like you're talking to me.
Again.
That's why I'm like, because no, honestly, I got some stretches from a doctor. I think I've done them twice. Because when I was doing it, I was thinking, what is this? Like, why am I reaching to the ceiling? This is not helping me. But that's why I'm in the predicament now. But anyway, okay, cool. And yourself, typical day in the life?
Typical day. We start work at 8:30, so I leave my house around like 8:10. Because it's literally down the road from me. So I've been in this role for about 6 weeks. So
are you in a clinic as well?
Yeah.
Are they always clinics?
No.
Or
so because I've moved, I made a transition. So I was doing rotations for a year. So we were like hospital based, we were like in the clinic. At the moment, I've gone into like MSK, so that the sprain side sort of thing, the back pain side. So we're based in the clinic. So first patient's at 8:30. We don't finish until 4:30. With each patient, we get roughly about half an hour for each patient. We probably get about 5 to 6 new patients and the rest are follow-ups. So difference between follow-ups and a new patient. A new patient, you've got to get your subjective history, which is, you know, asking how did it happen, what do you do for work, like what's your day-to-day life sort of thing, how did the injury happen, so you kind of get background information. This normally kind of directs me into, okay, it might be this or might be something else. Then we do the objective side, which is basically you do your test similar to Tamara, what we do in terms of look at how they're moving the joints, and we also look at the joint that's affected them and a joint above and a joint below. Because again, like I said, you know, sometimes with referred pain, if you've got problems with your hips, it might affect your knee or your ankle, but you're not looking at your hip, you're looking at your knee because your knee's painful. And then, looking at like, and then we go on to the treatment side. So this is normally where I teach them the exercise, kind of give them education as to what's going on. A lot of patients normally come with arthritis and they think, oh my gosh, my bones are crumbling. That means I'm, you know, that's damaged.
Oh wait, can I say, okay, I think arthritis is when your cartilage is wearing off. Is that correct?
Correct. That is correct. It's completely normal, and they say no. There's loads of studies. Some studies say that it starts from the ages of 20, and they go, and then from there you start getting arthritis. It doesn't necessarily cause you pain. What tends to happen is sometimes the muscles then stop working properly, or you get a bit of stiffness, which then changes your body mechanics, which is what causes the pain. So I try and teach all my patients that, you know, yes, you've got a bit of arthritis, but it's not the end of the world. We're going to manage the pain by making the muscles stronger. Stronger the muscles are, the less likely it's going to cause that, you know, that rubbing on the wear and tear.
Cartilage, like, you can't grow again, can it?
So
there's nothing you can do.
With arthritis, it's degenerative. Not necessarily. There's like some supplements that you can help aid to keep what's there already. But there's nothing necessary that says you can regrow. So that's why we want to try and maintain what you have there and then sort of thing by making the muscles stronger. But there's nothing to say it's going to grow back, or there's no fix, or there's no cure for it as per se, unless, you know, you get like a knee replacement or hip replacement. But that's a surgery and stuff, and we're not looking at that for the patients that come in, sort of thing. So once we taught them the treatments, then, you know, we send them off with the exercise or the stretches or the hands-on, etc. And then we normally see them for a follow-up in about 6 weeks. With our follow-up patients, it means we've seen them already, we know everything about them, sort of thing. So now it's kind of like looking at what have you done in terms of the exercise. So again, we look at the exercise and we know whether they've got the stretching or they've done the exercise we've given them. Because one, I normally ask, have you done them? They go, oh yeah, I do them every day. And I'm like, okay, show me how you do them. Either it's really poor technique. They've made up their whole new stretches and their whole new thing. Or they're like, I'll be very honest, I only done it one time. I'm like, yeah, that's fine, but at least now I know this is what we're working with. And if you've not gotten better, probably this is the reason why, because you've not followed what it is. So a lot of ours is independency. So we're trying to promote independency. You do it on your own. Yes, I can put hands on, but normally the hands-on things that I do won't fix the problem. It acts as like a paracetamol. It helps with pain relief, but normally the main thing to keep it long term is like, you know, strengthening and the stretching, etc. And I finish at 4:30, and when it's 4:30, I'm out of there.
Joking, not joking. Okay, so you guys are only 24 years old. So when you see older patients, are they sometimes like, oh, you guys know what you're doing? Where's the main person? Are you not the assistant? Have you ever had any of that stuff before?
Yes.
How do you deal with it? Do you get annoyed, or do you just laugh it off? Like, how do you deal with it?
Laugh it off, I think. And I've also had, because obviously I'm quite slim. I've also seen men who come in quite big, muscular.
I bet they're like, you sure you can help me out?
Oh, can I see someone else? And I'm like, no, like, trust me, I know.
Cheeky.
Yeah, trust me, I know where, like, you know, once I find where the problem is, then they're still like, oh, yeah, okay, yeah. Yeah, I feel that. I'm like, yeah, of course. Like, you know, but you just have to laugh it off. Yeah, you just have to laugh it off, because then I'm a strong believer in your work proves itself. Like, I don't need to stand there and say to you, oh, I've done this, I've done this. My session and how it's laid out will show you that I know what I'm doing. And
I love that.
It's gonna be a difference.
Angie said she stopped clicking her fingers, means she's doing this. Like, she's loving it. She's loving it.
Should I stop?
I was thinking like that. Oh, you mean the knuckle clip?
Yeah.
Oh, yeah. Like, I'll let you guys answer that. I hate that. You know when people click the...
Yeah. I mean...
Is that bad? Is it good?
Hearing clicking in your body doesn't necessarily mean damages per se. I'm a very clicky person because I'm very hypermobile, so I can go like that with my wrist. But because of that, I click all the time.
Okay.
Yeah.
Okay.
I've scared you now. But literally, I'm very clicky person.
There's not an issue there.
No.
It's just a bone.
It's you've got fluid around every joint, and sometimes what it is if you think about like bubble wrap, you know, when you hear the popping, sometimes it's just air bubbles like doing that popping that gives that clicking.
If it clicks and there's pain, then there's a problem.
That's why, we always ask, do you get pain with the clicking? If they go no, it's just like, oh, okay, then I will show them my party trick that, look, I click all the time. And nothing's happened, as per se. So
it's not bad then, so Angie can carry on.
Like, you can probably see my palm, like that's like from working, like when I've had a long day working, it just starts clicking.
Meaning it's a bit tired.
Yeah, just because it gets tired, it just starts to click. It's not like
a bad click.
It's just more annoying than damaging.
Okay.
If anything.
Okay, let's get into some more of the questions. Mary says, how has COVID affected them, especially Tamara? So I think you answered that question already. What do you see the future of physio becoming?
I think a lot more hands-on than it is.
I personally hope it becomes more hands-on. Because me personally,
what do you mean hands-on though? Because it is hands-on, isn't it?
My philosophy is being as hands-on as I can. Like, it may sound creepy, but if you come and see me, I want to touch you. I want to see what's going on.
Yeah.
Whereas you tend to find a lot of physios are just like, do this, do that, do this, and they're just watching you do it and maybe correct you a little bit. But I actually want to massage, maybe get an elbow in there if needed.
I mean, I am your guinea pig. I mean, not now, but you can do that.
I actually want to physically like move you about and help you, and then at the end we're going to do the exercises and stuff like that. And I personally do hope it becomes more hands-on. Because it's needed. People are coming to you with back pain, and they don't want you to lay them down on a mat and have them doing sit-ups and planks.
Because we've done that. We tried that ourselves.
They want you to get into there and release it a little bit for them. Then give them exercises at the end. Like I said, if you want to keep this kind of level of freedom in movement, you got to keep doing these stretches.
I think it's finding that balance sort of thing between the hands-on and the hands-off, because unfortunately, at the moment, we've only got a certain amount of time. So we've got the half an hour. So if you spend the half an hour doing massage, it's like, okay, the patient leaves feeling okay, but then we don't see them for a follow-up for another 6 weeks. And then, you know, the pain normally comes back after like a week because, yes, we stretched it during the session, but we've not managed to maintain it. So we try and increase the independency. But especially like at my clinic, we do a lot of like, because they brought acupuncture back in. So before
What's
there was
acupuncture?
You know, the little needles when they put it in.
Yeah, what is that? And there's also a cup thing. Is that stuff real? Is it actually?
So again, it's sort of like in the same basket, I think, as like massage. It's more going down the pain relief side. It doesn't fix the problem as per se, but it can help with pain relief.
Okay, got you.
So it's, again, I always would describe it as it's working as a paracetamol. You know, it helps with the pain, but it doesn't get rid of the problem. Unfortunately, the problem comes with the muscle imbalance, comes with the, you know, you've got a weak this or you've got tight, etc. So you need to stretch it. You need to, but then again, people come and they like the feeling of, you know, having their hand, sort of thing, leave and relieved. So I think that's why when they ask, you know, the future of physio, I think hopefully as physio becomes more wider, more people will be able to be more hands-on. Time will allow us to do a bit more in our sessions. So then we can do like half, you know, hands-on, half education, half teaching and stretches to send you home with.
Right.
But again, in a nice way, we don't want to have to keep seeing our patients. We want you to get better so that you're able to self-manage on your own.
Yeah.
So it's a lot of, again, the education, the teaching. Yes, you've got pain, but pain doesn't always mean damage.
Yeah.
It means that something's going on and your body's perceived, oh, okay, something I don't like, and it sends signals down, you know, that pain's going on, help me. But that doesn't necessarily mean that there's your bones cracked sort of thing.
Okay.
But yeah.
Okay. And we discussed or touched on briefly about what's it called?
Chiropractor.
So tell us about that, guys, because I was actually looking into getting everything clipped. So you were saying that that's just like a quick, like exactly what you said, like a paracetamol. Yeah. But I think a lot of people have seen it on the internet, on Instagram.
And go,
that's cool.
Yeah.
Yeah. For me personally, you know yourself. You know, if you sit there and
anyone who doesn't know what a chiropractor is, if you can explain it.
Chiropractor is basically when they're going to crack your joints, basically get you clicking and for a nice little release.
Get you clicking.
Like we all know it feels good, you know, when you twist your back and it clicks. You're like, oh, that feels good. But then 5 minutes later, you're like, oh, I need to do that again.
Yeah. And
that's basically what, me personally, I just think your chiropractor, you go there, get clicked, you feel great, but then you want to go back again. You just become addicted to the clicking. You're not actually solving the problem as to why you need to be clicked.
Right.
You could have a weak kind of, so your back, you could be really weak in your core or, you know, glutes or hip flexors or something, which is causing you to then get this backache that you just want it to be clicked all the time. Whereas like, if you come to someone like us, we're going to say to you, we're not going to click you, we're going to sort out the root of this problem why you want to be clicked.
Right. I do click sometimes.
Yeah, we do click sometimes because sometimes it's needed, but it's not like our main
that's your
focus.
treatment. Yeah. We're going to give you something else on top of that.
We're going to solve this problem as to why 100%. You feel like you need to be clicked.
So have you guys ever met a chiropractor before? And ask them, why do you keep flicking? Why do you not get to the root of the problem?
They just say, it's good for alignment and all of this.
Oh, okay.
That's not necessary.
So they think what they're doing is legit then?
There's nothing to say that it's not. Cause no, you don't want to stop that. I actually took a course with. No, he was actually an osteopath, I think he was, to do spinal manipulation. So one of the things I do is spinal manipulation, which is basically what I was talking to you about in terms of sometimes I do kickbacks, but I do that within sessions because it's a quick one there sort of thing for the patients that come in and like, I've been to so many people, my back hurts, no one's doing anything. Sometimes I do a bit of
like me.
I do a quick of a back crack, just to get them on board that, okay, we've done a bit of hands-on, now let's get into the nitty-gritty of it. But they just see it as, it's your spine, it's your joint, you might free it up a little bit, but necessarily you're not actually freeing it up. It might be for a millisecond that you free up when you do the little crack.
It hasn't got to the root of that.
Basically, because the muscle's attached to those areas, and if that's what's pulling on it, you can click it back into place for a second, but it's not going to stay there. Because the muscle's then going to work, do what it does, and then you're back to square one sort of thing.
Okay.
But I mean,
okay. Next question. What causes arthritis?
There's not really any cause, to be honest. It's just something that. So your cartilage just degenerates, as you said, when you kind of get to 20, you've got less cartilage than you did when you were 10. Then when you're 30, you've got less cartilage than you did when you were 20. It just deteriorates,
basically.
It's basically age.
It's just age.
Literally what causes arthritis is just age. They say, as you know,
there's nothing you can do about it.
I suppose the more you're kind of, basketballers, netballers, people who are jumpers tend to get arthritis a little bit quicker in their knees because they've got more impact going through that joint, which is reducing kind of the cartilage at a little bit quicker rate than it would on someone who's not doing that kind of impact into their joints daily. But again, like you said, it's just age.
Literally, as you get to 20, I think the body produces certain things that thicken the cartilage. As you get older, they stop producing it as much, then it gets stiff a little bit. As you said, things that you do, high impact sports, basketball, etc. Where's it on fast? Where's the cartilage faster? So we just try and tell our patients, you've probably had it for a long time, but keep active. The more active you are, the less pain you feel. I think the main thing is not the arthritis itself, it's the pain that comes with it. And the pain is coming because, you know, something is painful, you don't want to move it. You don't move it, the muscles get weaker. Your muscles get weaker, causes more pain, and it then gets into a cycle. That's how I teach my patients, and it's like we want to break where there's weakness and put in strength by strengthening the muscles.
Love it.
Teaching it again that, you know, I teach them, if I fall on the floor right now and ask you to pick me up, your arms are gonna hurt. It's like you can say it, I'm quite a big girl, your arms are gonna hurt, yeah.
I mean, I'm joking.
That doesn't mean that your arms are broken or there's damage to your arms, but it means that your arms aren't strong enough, the muscles in your arms aren't strong enough to lift me up off the floor. And that's what sometimes happens with the body. When the muscles get weak, you're no longer able to hold your weight up, and that's where you get your pain.
Okay.
So it's not necessarily damage going on as per se.
Got you. That was really
say
good.
as well, I'm like a big advocate for stretching.
100%.
So for me, for my clients, as well as teaching them strength, I'm teaching them stretch, because it works hand in hand. You can be super strong and really like inflexible, if that's the word. So
Stiff,
if you're really stiff, you're going to get injured. Whereas if you're really flexible, really weak, you're going to get injured. You need the perfect balance of both, which a lot of people don't have, because you get people who are super strong and they're like, well, I don't, you know, people just still got this concept that stretching is for like gymnasts. If you want to do the splits, you know, that's why you've got to stretch. But I personally think like we need to get out of that kind of stigma about stretching, and that stretching is just a good thing for all of us to be doing. Even if you're an office worker sitting at the desk all day, you need to, you're one of the people that needs to stretch. Because you're going to be so, like, working in, like, places like Canary Wharf and stuff like that, you see these office workers who can barely lift their leg up, like, you know, they can lift it like 20 degrees, and you're like, is that how far you can go? And that's because they're just sat all day, like, so for me, like, I'm a big advocate for stretching.
Okay.
So,
Definitely.
Right. Do your stretches, guys.
Exactly.
100%.
Stretching,
Before and after your gym session.
especially after.
Is physiotherapy something you do? Is something you want to do forever?
Yeah.
I think so, yeah. I think, yeah.
I was like,
Yeah, I just love it. Like I said, I don't feel like I'm going to work.
okay,
I
yeah.
love it. Yeah.
And you?
Definitely. I think I don't... So mine at the moment, I know I want to do it forever, but I don't know if I want to stay in the stunt do or go off and do it. But I know it's something I want to do because it's one of those subjects where it's science. Science is always changing. Something new is always going to come up. What I graduated with, as time goes by, they're probably going to change, you know, what happens, and then you've got to relearn it. So you're always learning something new. What you see every day, you don't see the same thing every day, if that makes sense. So what I saw today, I won't see again tomorrow, or if I do, it's a different person. So they're coming with different goals, or they're coming with different symptoms, etc. And it's just like, okay, I'm always learning on the go. So I think it's definitely something I want to do forever.
Okay, awesome.
Up until 40, though, then I retire.
Okay.
You know.
That's young, you know.
Yeah, I'm trying to retire early.
Okay.
Kind of in the Bahamas.
So Angie says, I get really bad pains in my knees that I can't do certain exercises. Should I see a doctor or a physio?
Physio.
Physio?
Yeah.
See a physio, Angie. Maybe one of these two.
Yeah.
And then if there's any tests that we do that shows you need a scan or anything like that, we can refer you back to your GP. But yeah.
Cool. And it says, I don't believe cupping works. Do you think it does?
Me personally, I've never trained to do cupping, and it's something that I debated at a time. And when I spoke to other therapists, they were like, no,
It doesn't really work.
yeah, it just leaves you with bruises, basically.
Oh, wow.
Like, it's not like, because a lot of people think it's really good for like lymphatic flow and kind of getting everything flowing around.
Yeah.
So I think it's better for like getting rid of like toxins and stuff like that. I know a lot of people have it done for them reasons. So I think it's a bit better for that because it's getting everything flowing. But for actual like muscle tightness or something like that, I don't really
recommend it. Okay. And Edward says, do heat creams and sprays really work?
They just feel good, to be honest.
Because it's not. Anyway, you guys are the experts.
I mean, it depends. Like, I don't know if you've found, but me personally, when I've tried heat treatments on myself and then I've tried cold treatments on myself, I find that my body reacts better to heat treatments.
Yeah, I think it depends on the person you are, because again, I'm heat as well, but again, some people find cold. I normally give like things that are cold where you've got swelling because it helps with swelling. But if it's like joint aching, when you come out of when you come out of a shower, your muscles are nice and relaxed, you feel better, sort of thing. That's how I try and go down the heat route, in terms of it helps with pain relief, in terms of helps the muscles relax, but scientifically
it doesn't really do anything.
It just feels nice.
Good.
Same with the cupping. Like if you're going to do the cupping, pair it with therapy as well. If it helps, you know, some people need the hands on, and they need to feel you do something for them to be more, you know, prone to do your stretches or your exercises that you give them. But again, it's something I'm debating again, because I know a lot of other places they kind of want it, but again, I did the spine manipulation. I've only used it like a few times, sort of thing. So it's like, it depends where you go, what type of patient you see. Do they want hands on? Do they want hands off? It's nice to have both of them, sort of thing.
Okay.
So
cool. So we're going to just begin to round up. So any remarks or anything that you guys want to say for students or anybody who wants to actually get into sports therapy or physiotherapy? Do you recommend anything? A certain course, a certain book to read, anything at all?
I would just say, me personally, there's probably a lot of people out there as well. In uni, I learnt better with the practical lessons, and then when I went out and got my work experience, that's when I learnt a lot more than sitting there reading the books. Because for me, I needed to see it and then do it. So me personally, I would say for this job as well, you can sit and learn about the skeleton and all the muscles on it and everything. But when you actually go out and work,
it's
like,
completely
say, for example, the patella tendon, which is just below our kneecap here, on some people, like on the book, it's like dead straight like that. But me personally, mine goes slightly to the right. So when you're working, you're like, I remember being a student, like, oh my God, like I can't find this certain structure. But you just, you know, you need to fiddle around a little bit to find out where it is. So that's why I say get as much kind of hands-on experience as you can, because that will just help you so much.
No, that's really good advice. And anything from you, Jemima?
I think two main things. The first one is go in with an open mind. Don't go into the course thinking I want to specialise in this before you finished it, because you might go in and realise that you actually don't want to specialise in this certain place, or that you don't actually know as much as you think you do, sort of thing, which is what I learned. And also, like literally, as you said, sort of thing, like a lot of it comes from hands-on. I wouldn't be, as per se, really, really worried with what you graduate. Everyone wants to graduate with a first, sort of thing. But again, what you graduate with doesn't determine what you do when you come out of university.
I think in our job, it's our personality that gets us.
Definitely, because it's definitely a people's-based sort of thing. There's a couple of interviews that I've gone in and I'm like, I think I did really bad, but I'm really giggly and smiley, as you can see, sort of thing. It's like, you've got the job, and it's just like, okay, thank you, sort of thing. And again, as you said, every patient is different. You know, just because you can't feel for it doesn't mean it's not there. Treat what you see. Don't treat what the textbook says, they've got this, so this is what you must do, because it might not work with that patient. So it's literally just on the go, just doing what...
I'm going to be bothering you guys.
Don't worry.
You think I'm going to be like...
DMs are open, Meg.
Bother us as much as you like.
Remember you said that.
Bother us as much as you like.
You can see my Okay, cool. So, guys, it's been very, very informative. After this, we're definitely gonna go in the kitchen and do some stuff, because from this chair, my back is hurting. So, for those of you who don't know, and I hope you guys are going to attend our House of Medics ball, which is on the 27th of next month. It's going to be in a really prestige hotel in the centre of London. It's going to be lit. It's going to be keynote speakers, performances, DJ, a bar. It's going to be amazing. So our social media, on TikTok and Facebook and Instagram, it is We Are House of Medics. Our website is houseofmedics.org, and our Twitter and LinkedIn is House of Medics. So we will see you again in 2 weeks. And make sure you go to our website and book your tickets for the ball, because we're selling out. See you in 2 weeks, guys.
Bye. Bye.